Hello, welcome to day one of my mommy makeover journey. I'm so excited. After 4 IVFs and a beautiful baby girl to show for it and a C-section scar to show for it, I am starting with the VShape Ultra by Alma Lasers. Fantastic treatment. It works on the body, it works on fat, skin, and also scar tissue. A lot of mommies don't realize that flat belly that they're shooting to get is not just the skin and the fat, it's also dealing with the muscle and scar tissue. So there's a two-step process with the VShape Ultra. There's the ultrasound process and there's the skin tightening process, which is radio frequency technology. I have been blessed to be able to use radio frequency for about 14 years now. And I know it works because if you look under my eyes, I barely have any wrinkles, and that's from the RF treatment. So the first thing I wanted to do as soon as I could after having the baby was radio frequency, and now I can do ultrasound and radio frequency. So the first thing I want to talk about is that everyone hears about radio frequency, but they're not exactly sure what it is. And I kind of use this nifty little scale right here. They call it the electromagnetic scale. And even your microwave waves are on this scale. And radio frequency is a clear and visible wavelength. And really it's very, very safe. It gives out less energy than your cell phone and your microwave, and it goes in and the cells in your body respond to that wavelength. So you have a couple of different depths that the waves go in, and what we're going to focus on today is unipolar depth, which is one of the deepest depths, and it actually it affects the tissues as well as the fat. And what you want to do when you're doing a radio frequency treatment is you want to make sure that the energy goes far enough down, and that's why these waves kind of show you, so that you're going to be working both on the thin skin on top as well as the dermis, which is the mid-level, and then also your subcutaneous, that's where all your fat is. But the most important thing that I can tell you is that with unipolar, you have to drink a lot of water because the radio frequency responds to water, and when it responds to the water, that's when we start to increase the temperature of the body. The little water molecule here kind of shows it. Increasing the temperature of the body is how you get the cells to respond. So I always kind of joke that the fat kind of pancakes and the skin cells start to go into overdrive, and those want to start to produce collagen, and that's the biggest thing, is you want to produce collagen. So if you're not drinking enough water and your skin's not, healthy and in good condition, which we'll talk a little bit about, making sure that you do some prep prior to the treatment, you're not going to get as best of results. What I love about Alma too is that Alma does put everything through clinical studies based out of Israel. And what we're looking at here is the white is collagen, and it's showing separation of collagen, kind of getting that loose skin after having that baby. That skin has been stretched out, and then it shows just after 15 days after 2 treatments, you're starting to see more collagen form, more white, and you're starting to see the more compact collagen, which is that springy collagen that we want, which is what tightens up the skin. So you're gonna do these treatments anywhere from 1 a week to 1 every 2 weeks. It depends on your schedule, but it does take a while for the collagen to produce. Now we're also gonna add something called ultrasound therapy to the treatment. And the ultrasound will literally go in and burst the fat cells. Think of an opera singer bursting glass. We're gonna do a combination of ultrasound, bursting fat cells, then we're gonna do radio frequency that's gonna heat up the fat cells and also tighten the skin. And that's how we're gonna get the best results. So please subscribe to this channel, Enlighten Skin and Body Medspa and your Medspa BFF. And I look forward to taking you along this journey.